Hey, everybody, and welcome to our deep dive today. We're going to be tackling heart health.
Yes.
Specifically, those predictions doctors make about heart failure.
Yeah.
One thinks about cholesterol and family history, all that stuff. But what if I told you that, your neighborhood could play a role?
Absolutely.
Or even access to transportation.
Oh, yeah.
Crazy stuff like that.
It's true.
Could actually have a big impact.
A huge impact.
On your risk for heart failure.
Yeah. These factors are called Social Determinants of Health.
Okay.
Or SDOH for short.
SDOH?
And they're really making waves in the medical world right now.
So SDOH.
Yeah.
Break it down for me.
Oh, okay.
What are we talking about here, and why should I care?
So imagine.
Okay.
Imagine you live in a food desert.
Okay.
Right? No grocery stores for miles.
Yeah.
Or what if you need to get to the doctor, but it means like a 2-hour bus ride? These situations, these social determinants can make it so much harder to live a healthy life.
Yeah.
And that can unfortunately increase the risk of heart failure.
That makes you think.
It really does.
So how do scientists, measure something as complex as a person's social situation?
Well, researchers have developed tools to try to quantify that.
Wow.
One example is the Social Deprivation Index.
Okay.
And this takes into account things like income and education, employment, and even housing quality.
They can measure that.
Yeah.
That's wild.
To give us a snapshot of potential disadvantage at a community level.
So how does all this SDOH data fit into the whole picture of predicting heart failure?
Well, researchers are now adding this data into the traditional heart failure prediction models.
Okay.
And the results are really interesting.
Yeah.
One study, for instance, found that these models became even more accurate at predicting heart failure.
Really?
Especially for groups like women, Black patients, and those with lower incomes.
More accurate, you say?
Yes.
So how much more are we talking here?
Well, the traditional models mainly use clinical data, like blood pressure and cholesterol.
Right.
Which is important, of course.
Yeah.
But by adding these SDOH variables, we're getting a much broader picture of a person's health risks.
I see.
It can help identify individuals who might otherwise fly under the radar.
Gotcha.
They might have seemingly normal clinical indicators.
Okay.
But they're still at risk because of their social circumstances.
I'm starting to see how powerful this is.
It's really powerful.
So what kinds of specific SDOH factors are we talking about here?
The case study that we're looking at
Okay.
uses 15 different variables.
15.
Things like income and employment status, of course.
Yeah.
But also things like access to transportation, neighborhood safety, and even whether someone has a strong social support network.
15 variables.
It's a lot.
That's a lot to think about. I have to admit.
Yeah.
The idea of collecting all this data on my income and neighborhood makes me a little uneasy.
I understand that.
Yeah.
It's totally valid.
A little Big Brother-ish.
Yeah. Anytime we deal with sensitive information, it's crucial to have safeguards in place.
Right.
And that's where data privacy regulations come in.
Okay.
Things like high pay in the U.S. and GDPR in the EU.
Okay, so there are rules to keep our data safe.
Yes.
So tell me a little bit more about these regulations. What do they actually do?
Well, high pay stands for the Health Insurance Portability and Accountability Act.
Okay.
And it sets standards for protecting sensitive patient data in the U.S.
Gotcha.
For example, it limits who can access your health information and how it can be used. GDPR, or the General Data Protection Regulation, is similar.
Okay.
But it applies to individuals in the European Union.
Okay.
It gives people more control over their personal data, including the right to access, correct, or even erase their data.
Wow. So both IPA and GDPR are all about protecting our privacy and giving us more control over our own data.
Yes.
That makes sense.
It does.
But how do we make sure this data is used responsibly?
Well, one important step is transparency.
Okay.
People need to understand what data is being collected, how it's being used, and what the potential benefits and risks are.
Yeah.
We need to move away from complicated jargon and really explain things in a way that everyone can understand.
Transparency, I like that.
It's really important.
No more burying important information in fine print.
Right, exactly.
So people should feel empowered.
Absolutely.
To make informed decisions about their data.
100%.
And it's not just about getting consent up front either.
Right.
We need to explore these dynamic consent models
that
give people the flexibility to change their preferences.
Exactly.
Over time.
Yeah.
Dynamic consent.
Yeah. So imagine a system where you can easily access and update your data sharing preferences.
Okay.
Whenever you want.
Gotcha.
Maybe you're comfortable sharing your data for research, but not for marketing.
Okay.
Dynamic consent gives you that flexibility and control.
That's a great idea.
It really is.
It puts individuals in the driver's seat.
Yes.
When it comes to their own data.
Yes.
But let's get back to these heart failure prediction models for a minute.
Yeah.
How do we know they're being used effectively?
Yeah, that's a great question.
What are some examples?
That's exactly what we'll be diving into in the next part of our deep dive.
Okay.
We'll explore some real-world examples.
Sounds fascinating.
Of how these models are being implemented, the impact they're having, and some of the challenges and opportunities that lie ahead.
I'm ready.
Before we move on, we have a quick disclaimer.
Yeah, go for it.
This podcast is actually part of Anupa Roshan's final project.
Yes.
For a big data course at Arizona State University.
And it's based on some really impressive academic research.
It is.
We're using AI voices.
We are.
To create this conversational format, which has been approved by the course instructor.
It has.
This project is all about exploring how big data can be used to improve healthcare equity.
Right.
While addressing the ethical challenges we've been discussing.
Exactly.
And if you want to dive deeper into Anupa's research, there's a dedicated website with all the details.
There is.
You'll find pages dedicated to the case study, ethical challenges and recommendations for putting these ideas into action.
Right.
We encourage you to check it out.
You should.
We'll share the link at the end of the episode.
We will.
Great. Now let's get back to our discussion about those real-world applications of SDOH data in heart failure prediction.
I'm ready.
Me too.
So let's jump into some real-world example. Where incorporating this SDOH data is really making a difference. One healthcare system in Chicago, they used SDOH data to identify patients who were at high risk of repeat hospital visits for heart failure.
So they're pinpointing the ones who might need extra support.
Right.
What did they do with that information?
So they created a program that connected these high-risk patients with social workers who could help address their specific needs.
So it could be anything.
Yeah.
From like housing to food.
Exactly, like finding stable housing.
Wow.
Getting access to healthy food options.
So they're going beyond just treating the heart failure itself and tackling these underlying social factors that can impact their health.
It's all connected.
That's brilliant.
And the results were pretty impressive.
Yeah.
The program led to a significant decrease in hospital readmission rates for those patients.
That's amazing.
It is.
So it sounds like using SDOH data isn't just about making predictions. It's about taking action.
It is.
To improve people's lives.
You got it.
That's fantastic.
And there are other exciting examples out there.
Really?
In another case, researchers used SDOH data to develop an app.
An app
that helps connect people with community resources.
Like what kinds of resources?
Things like food banks, transportation services, and even job training programs.
So an app like that could empower people to take control of their health.
Exactly.
It's like having a personalized guide.
It is.
To navigate all those social determinants.
Exactly.
That's fantastic.
And these are just a couple of examples.
Yeah.
We're seeing more and more healthcare systems and organizations exploring these innovative ways to use SDOH data.
To improve care.
Yes, and to address health disparities.
It's inspiring to see this data being used for good.
It is.
But I imagine there are also challenges.
Oh, of course.
When it comes to like integrating SDOH data into healthcare.
Absolutely.
What are some of the hurdles?
Well, one big challenge is data collection. Gathering reliable and comprehensive SDOH data can be tricky.
Yeah, I imagine.
It often involves like piecing together information from a bunch of different sources.
Right.
And there can be gaps or inconsistencies.
Yeah. It's not like everyone has their information neatly organized in a database somewhere.
No. And even when data is available,
yeah,
there can be issues with data quality and standardization.
Oh, I see.
Different organizations might collect and record data in different ways.
Right.
Which makes it tough to compare and analyze.
So it's not just about having the data.
Right.
It's about making sure it's good data.
Exactly. It needs to be accurate, consistent, and usable.
What about privacy concerns?
Right.
I mean, we talked about IPA and GDPR.
Yeah.
But are there other things being done
yes.
to protect people's data?
Absolutely. Researchers are exploring new ways to de-identify data, which means removing any personally identifiable information.
Interesting.
While still preserving its usefulness.
So it's like using the data, but not knowing who it belongs to.
Exactly.
That's pretty clever.
It is a clever approach.
Are there any other concerns beyond data collection and privacy?
Yeah. Another challenge is building trust.
Okay.
With communities.
Oh, yeah. That makes sense.
Some people might be hesitant to share sensitive information.
Especially if they've had bad experiences with the healthcare system in the past.
Exact. Trust is crucial.
Yeah.
When we're talking about this. And respect it.
It's not just about extracting data.
Right.
It's about working together
to
find solutions.
It's a partnership.
This has been a really insightful conversation.
It has.
It's clear that incorporating SDOH data has the potential to revolutionize.
It really does.
How we approach heart failure.
Absolutely.
Both prediction and treatment.
I agree. We've seen some amazing examples of how this data is being used.
To improve patient outcomes and address those health disparities.
Just powerful stuff.
But as with any new technology,
of course,
there are challenges to overcome.
There always are. Data
collection, privacy, community trust. All crucial considerations.
They are.
But I'm optimistic about the future.
Me too.
It's exciting to see this collaboration.
It is.
To harness the power of SDOH data.
For good.
For good, exactly.
And let's not forget about Anupa Roshan.
Yes.
Whose research has been the foundation.
The foundation of this conversation.
Our conversation today.
For our listeners who want to dive deeper, be sure to visit Anupa's website.
You can find all the details there.
All the details about the case study.
The ethical and policy challenges.
And recommendations for moving forward.
Her work is a great starting point.
It is.
For anyone who wants to learn more.
About big data, healthcare equity.
And the ethical consideration.
Absolutely so, folks.
Yes.
Be sure to check out the website.
We'll include the link in the show notes.
And as always,
thank
you for joining us on this deep dive.
We'll catch you next time.
You know, it's amazing to think about the potential of all this.
Yeah.
To like truly personalize healthcare.
Right.
You know, we're moving beyond just treating symptoms and starting to address those root causes.
Absolutely. It's a paradigm shift for sure. And it's not just about heart failure.
Right.
We're seeing SDOH data being applied in areas like diabetes management, mental health care, even maternal health.
So this is just the tip of the iceberg.
Oh, yeah, just the beginning.
What are some of the most exciting developments?
That's a great question.
Yeah, on the horizon when it comes to all this.
One area that I think is particularly exciting is the use of AI and machine learning to analyze all this SDOH data.
So we can use AI to uncover even deeper insights.
Deeper insights, exactly.
From this data that's fascinating.
Yeah. And these technologies can help us identify patterns that might not be obvious to us humans.
So how would that work?
Well, imagine using AI to analyze data from electronic health records, social media, even sensor data from wearable devices. So by combining all this information, we can create a much richer, more nuanced understanding of a person's health.
Wow. So we're moving towards a future?
I think so.
Where healthcare is truly personalized. Tailored to each individual.
Absolutely. That's the ultimate goal, right?
It is. It's a powerful vision.
It is.
And it's inspiring to think about the role of all this in making that a reality.
We're on the right track.
But it's important to remember.
Yes. It's an ongoing journey.
That this is a journey.
We still have work to do. Data collection, privacy protection.
Right.
Building trust with community.
All those things are so important.
They're crucial.
But with continued collaboration.
Absolutely.
And innovation.
Yeah.
I'm confident we can harness all this power.
I am too.
For good.
For good.
To create a more equitable and just healthcare system for everyone.
Couldn't have said it better myself.
Well, on that note,
I
think we've reached the end.
I think we have.
Of our deep dive.
Time flies when you're having fun.
It really does.
Especially when you're talking about big data and healthcare.
Before we sign off,
yes,
let's remind our listeners where they can find more information about Anupa's project.
All the details.
All the details. The case study, ethical considerations.
Recommendations.
You can find it all.
On Anupa's website.
On her website.
The link will be in the show notes.
And be sure to check out her other work as well.
She's doing great work.
She's doing amazing research
at the intersection of data science and healthcare equity.
It's been an honor to talk about her work today.
The honor was all mine.
A huge thanks to Anupa.
Yes. Thank you, Anupa,
for sharing her insights.
And thank you to our listeners.
Yes. Thank you all for joining us.
For joining us on this deep dive.
We hope this has sparked your curiosity.
Yeah.
Inspired you to think critically about all this.
Keep those brains working.
Until next time, stay curious.
Yes.
And keep exploring.
See you later.